Heidi Godman, a daily dose of health and wellness information.
My guest is Mary McAndrews from Lasting Looks. Mary is a licensed paramedical esthetician and permanent makeup artist. Welcome back.
Thank you so much, Heidi, for having me.
What is Oncology Aesthetics?
Well, Oncology Aesthetics, as you know, we work with the body from the inside out. We really try to help women look and feel better while they're going through chemo and radiation. As we know, a lot of women deal with hair loss, nail issues, conditions with broken capillaries or lesions on the skin. So we really try to address any of those cosmetic or aesthetic issues while they're going through chemo and radiation.
What can you do about skin conditions like that when you're going through the treatments?
Well, the best thing to do is really, kind of take a look at what the condition is. If it's broken capillaries on the skin, it's pretty easy to remedy. We do what's called an electrocoagulation machine, which cauterizes the vessels so that there's no more blood flow to the surface. So the redness and the broken capillary that's showing its ugly face on the surface is minimized. We also can remove surgical markers after breast reconstruction. Those are usually placed by the surgeon after putting in the implants. And we have a tattoo removal system that actually takes those markers out. So it gives a cleaner look to the breast area. But there's a lot of different homeopathic remedies as well that can help with extreme dryness or cracking of the skin.
Oh, tell us about them.
Well, I really love calendula because it's great for splitting cracks around the corners of the mouth or just excessive dryness. It's from the marigold plant, and it is a homeopathic medicine, so it's not going to interfere with any toxicity already going on with them. Their doctors usually will approve of something like this. There's also arnica. If they have bruising around their port area where they're having their anesthesia or medicines put into their body, they might have some bruising or excessive redness. And arnica is also another homeopathic root that will help to calm the redness.
What about hair and nails? Because sometimes hair falls out during cancer treatment. Not always, but sometimes. Mm-hmm. And what happens to the nails? I would imagine they get very brittle.
They do get very, very brittle. And vitamin E oil is very, very good. You have to be careful when you're going through chemo and radiation because the skin does purge the chemo through the skin. It is your largest organ on the outside of your body. So when you're near children or even pets or with your husband, you have to be careful because the chemo is coming through the skin. And it does dry the nail bed out as well. So vitamin E oil works really well on the hard keratin of the nail, whereas for the skin, calendula or arnica would be a little bit better.
We are talking about how to help your body when you're going through radiation and chemo for breast cancer treatment. My guest is Mary McAndrews from Lasting Looks. She is a licensed paramedical esthetician and permanent makeup artist. So what if the hair does not grow back in certain places, such as the eyebrows or the eyelashes after you've gone through the treatment? That's something that you can help with too.
It is. As you mentioned, I am a permanent makeup artist, and a lot of times women will come in post-op from their chemo and radiation and really on the other side of having the cancer, and their hair has not grown back. As you know, there's a lot of products on the market that we offer and various doctors offer that will help to stimulate the hair growth, but sometimes even with those products, the hair does not grow back. So what I like to do is have a consultation with them and really look at pictures of them maybe in the past of what they used to look like and what color their hair is, or if they're going through various shades of hair color at that time. Sometimes the hair in the head even comes back thicker. Other times it comes back curly when it was straight before. So what I like to do is draw on them and really show them size and symmetry and color and really see what shape I can give them, and then do a permanent makeup procedure, which is an art form of tattooing where they will have that shape and color there. They won't have to draw it on every day, and that'll just save them a lot of time and effort every day.
Yeah, and speaking of tattooing, you're an expert in that medical tattooing, especially in the last step of the reconstruction process when it comes to reconstructing the breast, and that is the repigmentation of the areola, which is the very pink and sensitive skin around the nipple. Tell us about that.
Right. Well, I became an expert in areola restoration and nipple restoration about 7 years ago, where I saw there was such a need when these patients were coming in to have their eyebrows done that they really had no pigment left in the areola area. So I started to take a look at them and realizing they had very little feeling left, unfortunately, after breast reconstruction. So I was able to tattoo in this area without causing them any pain. So what I will do in a consultation is I will have them, I will paint on them and showing them size, again, symmetry, take their skin tone into consideration. And I'll go ahead and show them how I can camouflage all the scars that they may have. Some of them come out very clean and they don't have a lot of scar tissue. But most of the time, if they have had the areola reattached, there is some scar tissue and some hardened collagen. And what I can do is a special process that I break down that scar tissue, and then I can implement pigment and give them pretty close to the color that they used to have. If they have not had an areola or nipple attached, then I can actually give them a 3-dimensional effect by shading and using various colors to give a lifting effect and dimension to the area.
And how many sessions does that take to complete that tattooing?
It usually takes 2 to 3 sessions done about 8 weeks apart. So it's, it's really something that gets them back to normalcy. I find that when they look in the mirror and they see no color there is, one thing having no feeling. But since men are very visual, and I find that even just us looking at ourselves, just to have that color put back in, kind of takes them back to where they were before all this happened. It gives them some sense of normalcy back.
I would imagine that doing all of these things that you've been talking about gives the sense of normalcy back to someone, really a feeling of being whole.
It does. It really does. Even, men don't know what to do when women are going through this. They're losing their breasts and children don't know what to do. And I know doctors advise the patients to be very careful going through chemo and radiation and who they come in contact with. So this, allows them to feel, yes, whole and normal again. And just, be beautiful again.
Because there are a lot of psychological effects of going through breast cancer.
There really are. I've heard a number of stories. I mean, this wasn't a field that I ever imagined myself being in. I came about it through being a makeup artist for many years, became then a permanent makeup artist, and found just such a need. And now I have, just such a passion for doing areola restoration on these women because, yes, I feel like I'm really doing a really good thing for them.
Well, I know you do so much for our community, and you are beloved among all of the breast cancer survivors. So thanks so much for coming on today, and tell us how we can get a hold of you if we want more information.
Well, I'm the owner of Lasting Looks of Sarasota. It's 3300 South Tamiami Trail, which is 1 block north of Siesta Drive. Our number is 941-539-7990, and we are there every day.
Okay, Mary McAndrews from Lasting Looks, thanks so much for coming on the program.
Thanks for having me, Heidi.
And thanks, everybody, for tuning in today. Hope you have a great afternoon. I'm Heidi Godman. My producer is Tyler Whitson. This has been Health IQ, and you're listening to WSRQ. Bye-bye.